Welcome back, pet parent. We have an impromptu recording. I'm so thankful for Kara being such a dear friend. She has been on the podcast before with Raw Remedies Health, though I think the last time you were on, you were still maybe Raw Paw
Raw Pod Adventures,
Adventures.
yeah.
Yeah. It's funny because like you're transitioning to Raw Remedies Health. I'm transitioning to
Wild
Wild Wellness.
Wellness, yeah.
We're just all doing all the things. But today we are talking about an integrative approach to emergencies with our pets. And I literally texted Kara and I was like, I'm all set up to record and my guest rescheduled. Are you free like right now? And she's like,
Kind of.
kind of, we can make it work.
Yeah.
So first of all, we are going to talk about an integrative approach to emergencies because I think that is one of the times where we are freaked out the most and it's the easiest time to be like, we lose everything. We lose our train of thought. We can't process. We're like, we're just going to do whatever the vet says because everybody is like, our adrenaline is rushing and everybody is like, you have to do this or your pet's going to die, all these
Yep,
things.
yep.
But before we do that, like, give me that update to Raw Remedies Health.
Yeah, so I did a little bit of a transformation essentially. So when I started out Raw Pod Ventures, it was very kind of fun, fast living, taking adventures with my dogs, going off-roading, figuring out how to feed fresh food while I'm in the middle of the wilderness, which was a lot of fun. And that was really great 3 years ago, almost 4 years ago now. And things have really changed both in our lifestyle, but also in the way I approach health overall. And I really take a functional approach to health now for myself, my family, my pets, my patients at work, right? The human patients, my clients that are the animal clients. And I just really wanted my business name to reflect that growth that I've had. And I really had it up in the air for a little while. I was like, oh God, do I rebrand? What if I lose people? But I finally decided I had to pull the trigger because I couldn't be Raw Pod Ventures forever because it's become a lot more than that. So I just wanted the name to encompass what my outlook on health really is.
Yeah. Well, I mean, I feel like I've rebranded multiple times, so
The queen of the rebrand.
right? But you evolve.
Yeah.
I mean, when I first started doing this, I was doing dog training
Yeah.
and, just positive and then, like, as you evolve, like, it just doesn't make sense to be that anymore. So I totally get it. But what if feel free to share as much or as little as you want
Yeah.
about why we are talking about this today because you've had first of all, you just moved, which is huge. You moved literally across the country. I've been there. It sucked.
Kim
Kim is in
attests.
agreement with
Yeah.
me.
She said, that was tough, Kara.
She's
I'm
like,
proud of you. I'm pretty sure that's what she said.
yeah, that's what she said.
Yeah. Or maybe she actually said, you're a fool. What's wrong with you? Who knows? It could have been either. This this could go down in the history of the podcast where Kara finally cries. I don't know. We're gonna find out.
No. Oh gosh.
It's okay. Yeah. So we moved. You are correct. We moved. So the very quick streamlined version is 4 years ago when my husband and I eloped and decided that we wanted to live in warm weather forever. With very little advanced planning, we decided to completely uproot our lives and move to California. Spent 3 years there and realized that we could not sacrifice community for beautiful weather. And there's just something about Buffalo, New York that I really feel is not like anywhere else on earth. And I used to make fun of people for saying that, but now I get it. So we did a second uproot. I decided to move home. So we got home, I don't know, 2 months ago, actually almost exactly 2 months ago to the day. And it has been a whirlwind since then. So we moved into an apartment and, this kind of sets up the talk for what's been going on. But we moved into an apartment that we're renting from a friend. So new space, unpacked the best we could, which is always stressful for animals, I think. Then we decided to buy a house because the renting market in Buffalo is outrageous. And we quickly determined that we could not possibly fathom paying so much money for rent when for maybe $200 more a month, we could just pay a mortgage and have equity. So we weren't going to do this. but we found a place that checked literally all of the boxes. So we were like, okay, I guess we're doing it. So we bought a place and then started packing up everything again 2 months later, which is just insane. Um, and I think all of that had a really negative effect on the mental emotional health for our oldest dog, Piper, who always has been a tad anxious at baseline, but who now is, I mean, a literal ball of stress to the point of self injury, which we'll get into. So it's been not a great week. I'm blaming it, Jess. I don't know about you. I'm blaming it on this beaver moon, girl. You know, tonight is the full moon. Why are they calling it the beaver
Yeah.
moon? Do you know? You're the astrology girl.
I um, I didn't look into why they're
Yeah.
calling it a beaver moon.
I should look it
It
up.
is it is a crazy, like, powerful moon in Taurus. Like, pretty much everything that I have seen is like, just be as solitary as you can possibly be right now.
Yeah, I could actually I feel that. I feel that. But so I'm blaming it on the full moon, but yeah, so just a lot of upheaval and a lot of changes and animals aren't always great with that, neither are people. But I think sometimes we have better coping mechanisms and the older animals get, I think the harder it is on them. And so this has just been a tough move for Piper. And hopefully this is going to be the last one in a few weeks when we actually officially pick ourselves up and move 40 minutes down the road. I really hope that's the last one because we're tired.
No kidding. No kidding. I mean, I feel some of your pain because while I don't have the same issues that you're having with Piper,
Yeah.
which I know you'll get into in just a minute, Kim has been struggling this year too. And it's so much so that like her gut health is not where it used to be. Like we
Yeah.
have so much going on and it is a lot of stress and it has a lot to do with moving and not being in oh, yeah.
It's very windy here.
Uh,
Hopefully, I don't lose power.
yeah, I saw your lights flicker.
Yep.
Um, it like, the stress we underestimate what stress does to our bodies, and I think we underestimate what our stress is also doing to our pets' bodies on the
Mhm.
top of the fact that, like, just the physical move, just being in another environment, also being in an environment with another dog when she's not really another
Yeah.
she's a dog that doesn't like other dogs. She will play nice sometimes, but that's a lot of added stress for her, and then
Yeah.
my stress on top of that for her, it's just been and I know her gut is messed up because I've done the testing and I know, like, it's a mess. So, I feel a fraction of your pain.
It's hard being a pet parent because you feel so much guilt and responsibility. Ugh.
Mhm.
And that's where I'm really
Yeah.
struggling the most. Like I think she's fine. I mean, so let's talk a little bit about what happened. So we'll start with Piper and then I think maybe we could then we'll move on to Bear because don't worry folks, there's not one, but two recent pet emergencies in my house.
My
I'm
goodness.
just like, what's happening? So we moved home, as I said, 2 months ago for me, but actually almost three for my husband. He came and started his job before I did. So we moved separately. And he came with the dogs and the cats. And I stayed behind in California for an extra month. So he had to deal with everything on his own. And when we first got home, we selected an area of the apartment, this long front room that would be maybe a sunroom, I guess you could consider it, and it's where the front door is. And then there's another door that leads into the house. So it's just this long rectangular room. And we selected that as the room where we would keep the animals because the dogs do like to chew on things and destroy things and romp around and whatnot. So we had nothing in there except for the freezers where I store their raw food. They don't get a dog bed because they destroy the dog bed. It's just, that's it. This is where you stay. And we have been doing that for years when we go to work. They stay in a spot in the house. They lay on the floor, they survive. We come home, we snuggle on the couch, everybody's happy. Well, Piper pretty quickly started chewing on like the corners of the molding, the edging on the door, and I didn't realize this was happening because I wasn't home yet. So
Mhm.
then, I know, Kim, right? I don't understand either. So then my husband flew back to California and we hopped in our one remaining car that we left in California, and we took a 10-day road trip, just the two of us, across the country to get home. We stopped at some national parks. I had a friend of mine stay and watch the dogs. And I talked a little bit about this on my episode with Isabel because I made some mistakes there. And we talked about the importance of professional pet sitting. But my poor friend, on the very first day that he sat, he came home and found that she had ripped up and destroyed a bunch of the linoleum floor in this front room. So from across the country, my husband and I went, oh, what do we do? So we bought a crate. Now, when she was a puppy, she had a crate. She had one for years because she was a very anxious puppy when my husband had her. It was before we met. So she was in this crate. She never tried to get out of this crate. It had thick, thick bars because she had proven able to chew out of a wire crate. So it had big, thick metal bars like a jail cell. So we bought her the same one that she used to have, thinking she'll be fine. She's in the crate. I had them start giving her calming CBD, and we got home 10 days later. A couple of weeks after being home, me home now, I came home from work and discovered that she had a chip on one of her canines. And I was like, how on earth could this have happened? You haven't had any raw meaty bones because I was still looking for a supplier locally. So I go and I investigate the crate and found that somehow this 35-pound dog had managed to dent these thick steel bars with her teeth, and she chipped her tooth. So I'm like, oh my God, what do I do? And at this point, only one canine was chipped, which is more than enough, in my opinion. Now, it wasn't chipped to the degree where I was worried that it would have to be extracted, but it clearly was broken. And so I went ham on the calming stuff, right? So I pulled out, I have some of the stuff next to me. So I have the full spectrum hemp extract with lavender essential oil. So this is calm. And I have the horse strength one. And then I also have Blanche's edibles, which is one of their favorite treats. And this has full spectrum extract in it as well. And then this is their partner with Cocoa Therapy. So CBD Dog Health and Cocoa Therapy. Love them, love their treats. So I started giving her a couple of treats when I left to get the additional full spectrum. And then I had Glacier Peace. And, I had actually gotten this for the cats for the car ride. And my husband ended up not needing to use it. So it was just sitting here. And I said, oh, what a great coincidence. So I gave her Glacier Peace in the morning as well. So now that's 2 tinctures in the morning, plus some treats. And then I got some Calm a Mile, which is the essential oil blend from Melissa Shelton's Animalio. Yes. And I started diffusing this. I also reached out to the amazing Natalie Lampus, who has a lot of experience with essential oils, and she sent me a care package. If you're listening to this, you are an amazing human. She sent me a care package of little samplers of different essential oils and taught me how to let Piper self-select. So we were in the midst of letting her do the self-selection. I hadn't found anything that was very clear that she liked. So we had a lot of maybes and a lot of no's so far. In the meantime, I hope I didn't lose you, Jess. It said I'm trying to reconnect. Okay. In the
Oh, we're good.
meantime, I
We're good.
started diffusing the chamomile. And we also swapped out her crate. So if you can even imagine, apparently there is an upgrade beyond jail cell bars. You can actually get, I'm almost picture it, guys, like Swiss cheese, like holes. This is like all around heavy duty, made out of metal, and it has holes that are like, I don't know, like the size of maybe my eye. So not huge, but not small. I didn't love it because I thought, well, I don't want her to not be able to see out, but I also can't have a bar for her to wrap her teeth around. I also can't have her rip up more of this linoleum. And I can't have her, ruining this apartment that we're renting. And we only have a few more weeks until we get into our house, and then she can be free in an area. And if she chews on something, well, then we'll figure it out, but it's our house and it doesn't matter. And I was just saying 3 more weeks, 3 more weeks, 3 more weeks. And we set up a camera. We put the camera in the room so that we could listen and we could see. And we were like, it's going to be okay. A couple of weeks went by in this new crate. Everything seemed fine. We weren't getting a lot of alerts on the phone. I thought, oh my gosh, all the natural stuff is working. We must be in good shape. And then last night, November 4th, my husband's birthday, I came home from work, leaned over to give Piper a kiss, and saw that she had a snaggletooth. And I was like, oh, that does not belong there. So I reached out with my finger and I gave it a little poke and it wiggled. And I about lost my marbles. Not that I had many to begin with. So you can imagine this turned into quite an affair, right? So, like, my husband and I are like trying to open her mouth enough for me to see what's going on. She doesn't want our hands in her mouth. She's squirming all around. I'm panicking because I'm like, oh God, what if it's loose and I knock it out all the way? Like, it was a fiasco. So finally, and that upper tooth had chipped more. So finally, we're able to get in there, and I'm thinking, like, all right, maybe it's barely attached. I don't know why I thought this, but boy, was I wrong. I thought, oh, maybe it's barely attached, just like a kid's tooth when it's going to fall out or whatever. And it's just like hanging on by a flap and it'll come out and she'll be okay. Negative. It is completely diagonally broken, fractured. And I can graphic, guys, but if I were to take the tooth, I could bend the wiggly part forward and you would still see that diagonal root and stump in the molar, and you can see the center where you have the nerve and you have the blood vessels, right? I was so upset when I saw that. I just could not believe it. So that was last night. So it's like when something like that happens, what do? You could go to an emergency vet. They're probably going to give you pain medicine, maybe an antibiotic. I don't know what an ER vet's going to do. Charge you a lot of money, tell you to go see a dentist, right? They're not going to put her under anesthesia at 7 o'clock at night at an emergency vet and extract a tooth. They're just not going to. So after I was done hyperventilating, I sat down with my husband and we did some brainstorming. And I decided to call around to some veterinary clinics today and see if I could get her seen with the intent of knowing that she was going to have this tooth taken out. Unfortunately, we don't have a primary vet yet because we just moved home. Also, unfortunately, she's not up to date on her rabies because we titer test. And so I was just dreading the conversation with the vet, you know? Like, I feel like you probably just had to get a new vet, right? Or have you looked around yet for a
Yeah.
primary vet?
So I've been here since February, and it's the beginning of November when we're recording this.
Yeah.
And I just found a vet. And it
Oh,
was literally by like happenstance because I had tried multiple vets. I've called all over the place.
yeah.
I had this same issue when I moved to Texas. Like I probably called 60 places
Yeah.
just to like see what kind of response I was going to get from people on the phone
Hmm.
to decide if it was even going to be worth my time going into the clinic.
Yep.
And I probably called maybe a dozen or so around here and went to one clinic that they gave me all the, like, right answers when I called and talked to them, but then
Yeah.
when I actually got there and talked and, like, had Kim seen by the vet, it was just
Mm.
bashing me for everything I was doing, and I'm like,
Yep.
"This sucks." And I just happened to be meeting my stepmom for dinner one night, and I got there a little early, and I looked, like, across the parking lot, and there was a vet clinic. It was just a there wasn't anything special about it on the didn't say integrative or holistic. It didn't say any of that
Yeah.
on the, like, sign, so I just walked in and started talking to them. And it turned out that one of the vets there is like, "Okay, like, whatever." Like, yeah, I
Yeah.
have to tell you that it's state law
Yeah.
that we right? But, like, I just when I went in for the appointments, I took the cats first and then Kim after that, and they literally just checked. They were like, "Okay, you titer test," and they just checked the box to, like, not send me notifications
Yeah.
for vaccines, and I'm like, "This is, like, awesome. Thank you."
Yeah. Well, that's what I was hoping I would eventually find. And I was
Yeah.
taking my time looking around and calling clinics and asking if they accept titers, if they're okay with fresh feeding, if they essentially have a similar philosophy of care or at least will respect mine if it's different than theirs. And
Yeah.
I didn't think that I was going to have a deadline to find someone.
Mhm.
And so I didn't have anything set up. So today comes now, so it's November 5th, and anarchy ensued. No, I'm just kidding.
No.
So remember the 5th of November. Okay. So I go to work and I'm at work for an hour and then all of the clinics open around here and I start just calling one after another. I literally just pulled up Google and was like, okay, got to find somebody. So I
Yeah.
called a few that had like put dentistry on their like, as a specialty
Mhm.
that they promoted. None of them would take me because I didn't have a referral from a primary vet locally.
Mm,
Okay.
interesting.
So then I was like, well, I don't know, maybe I can call Cornell University because they have a dental clinic and it's like a 3-hour drive, but I would do it. And I couldn't even find the correct phone number. Like I was online for
Oh my
like 15
god.
minutes looking. I was like, okay, I don't have time for this. It took 7 phone calls, but I finally found somebody who said, yeah, we can see her for an appointment for an injured tooth today.
Awesome.
And I was like, I'm at work. So I go to my office manager, who is the most amazing human being in the entire world. She shuffled around my patient schedule and she let me leave early. So I drive all 45 minutes home in the gusting wind, which, by the way, if anybody drives a Jeep Wrangler in the wind, it's more like sailing a ship.
Yeah.
So I get home, pack up the dog, we go to the clinic. It wasn't the worst experience I've ever had, but it was a little bit frustrating. And I definitely was not 100% forthcoming about everything that I do because I immediately was shown that they are a very conventional space. So before I even made it to a room, as I was being checked in, the first questions were, how old is Piper? When did you adopt her? What do you feed her? Is her rabies up to date? And is she on flea tick heartworm prevention? Didn't even
Mhm.
get into a room. So I was like, all right, that's how this is going to
It's
go.
like it's like, what was the first like, you go in with a broken arm. What was
Hmm.
the first day of your last period?
Yeah. Yeah. Right. I cannot with this. Well, luckily for me, I get to just tell them I don't have fallopian tubes anymore. So that makes it easy. But so I said that I use natural prevention. And I said that I feed her a home cooked, balanced diet. If you're listening, I'm shaking my head. And then
Mhm.
I said, and I quote, I'm so sorry I don't have her records. They're from the vet in California. I feel like she must be up to date on everything because we're renting an apartment and I can't imagine we would have been able to rent if she wasn't. But I was so afraid that they were going to turn me away.
Yeah.
So that was what I
I get it.
said. Maybe guys don't take my advice, but maybe don't
Yeah.
do as I say. But that's what I said. I don't, whatever. So I get into the back. The tech comes back. They give me a form. I fill out the form. She leaves. The veterinarian comes in. This girl could not have been more than 22, 23 years old. I mean, oh my goodness, she was a baby. Good for her. We all start somewhere. We all graduate at some time. But she did not instill confidence in me. She didn't look me in the eye. She kept looking away from me.
Mhm.
When I could tell when she got embarrassed because her chest got all red and splotchy. You know, she was very hesitant and she left a few times and then came back and was like, I forgot to ask this. So clearly she just started, right? And she was going back and probably
Mhm.
conferring with an older vet who had more experience, who said, you know, oh, did you do XYZ? And she probably was like, oops, I forgot, and then came back, right? So I didn't love that. But I also, guys, am not in a position to be picky right now because I don't have a vet and I do have an emergency. And for anybody who's thinking like a broken tooth is an emergency, if you have ever had dental pain, you would know that dental pain is an emergency. It is
Okay.
extremely painful. And she had an exposed nerve root, right? So, absolutely, there is no waiting until I find someone that's going to say, yeah, I'm cool with a rabies titer. You know, we have to go. And if at the end of the day, they said that I had to give her a booster to get her tooth removed, I would do it because her
Mhm.
well being is more important. And then I would detox if I had to. Now, I'm hoping I'm going to get away with not doing it. But if it came to that, I would do it. I'm not shy. I'm not embarrassed. Her imminent well being is the most important to me. But luckily, she didn't have to get one today. So they proceeded to do an exam and said, well, definitely this bottom tooth needs to come out. Unfortunately, the top canine also looks like it's low enough that she has exposure, and that probably is also going to have to come out. And then she told me something that scared the shit out of me. She said that when you remove canines, especially lower canines, they make up such a large part of the jaw, and you have to actually drill into the bone to remove the root, that it can put them at risk for a jaw fracture. I was like, "What?
Wow.
What?
I hadn't heard that before.
That's, like, not a thing for people, okay? Not a thing." So I was really surprised to learn that, and that was the point where she actually got really embarrassed, and she, like, turned all red and was like, I'm not saying that that's common, like, that's never happened here, or well, I mean, I don't know if ever, but maybe not in a long time, and I'm just like, "Okay." So, she gives me that, I said, "Okay, I acknowledge that it's a risk for procedure." And then they came and they gave me the printout, and I don't know, has Kim or any of your kitties probably have had anesthesia or procedure, right? Like, I know
Yeah.
when I know about your kitty that had the arrest and that
Yeah.
craziness. So you know that they
Yeah.
give you like the printout that has, everything from A to Pluto. Uh,
Yeah.
right. So, they have the price of the anesthesia on there. They have the price of the extraction on there. They have the price of the blah, 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 blah. Well, they also had fluoride on there. And I was like,
Mhm.
"Can I decline this?" And she was like, "It's no extra charge." And I was like, "I'm not trying to save money. I just don't want my dog to have fluoride." And she looked at me like I sprouted another hen.
Yeah. That's what happened the last time I
God.
had Machida's teeth cleaned. Yeah,
Yeah.
in Texas. I did the same thing. I was going over the form and it said fluoride, and that's the exact conversation we had. I said, "No
Yeah.
fluoride," and I marked it out and I wrote no fluoride, and they were like, "But you're not paying for it." And I'm like, "I don't care.
Yeah. I don't care. I don't want it. And she was like, "Why?" And I was like,
I will pay you more to not use
"Yeah,
it."
yeah, I'll pay you an extra $20 if you don't give fluoride." And I said to her,
Right?
"Because it's a known endocrine disruptor and it's not good for thyroid health." And she was like, I was
Yeah,
like,
right?
"Okay,
Yeah.
fine. That's fine." So I said, "No fluoride." Then there was just a bullet point that said medications.
Mm,
And I was like, "What does this mean?"
that's vague.
And she was like, "Well, it could be anesthesia, it could be for nausea, it could be antibiotics." And I was like, "Great, no antibiotics." And she was like, she looked appalled that I wouldn't dare. And I said, "I understand that if you get in there to remove the tooth and it appears that there's an infection, that she may need antibiotics. However, this happened less than 24 hours ago. And I can tell you from looking at her mouth that she has no signs of an infection. So I would not give her antibiotics because antibiotics should not be used prophylactically unless there is like an extreme circumstance, like you're a human with a prosthetic heart valve. Like, otherwise, please don't do it." And she was like, "Okay." But you know what I did elect to do? I elected to let her get pain meds because she's in pain.
Mhm.
And
Yeah.
so she's going to get an anti-inflammatory, which is an NSAID, a non-steroidal anti-inflammatory drug. So I said, yes, I'm okay with an NSAID. I also said, yes, I'm okay with an antiemetic because it's very common for animals to have nausea and vomiting perioperatively, which can put them at risk for aspiration. And in particular, the reason why I said I was okay with her getting her anesthetic is that unfortunately, this clinic does not have a dedicated anesthesiologist. And I
Oh,
did not want to risk potential vomiting aspiration if she's not being monitored by an anesthesiologist. Now, there is still someone there, the techs do monitoring. That is not satisfactory for me. But again, this is not something that can wait. So she's going to get a
yeah.
nausea med and she's going to get an anti inflammatory. And then on top of that, she's going to get some Ease, which is a full spectrum hemp extract with turmeric and boswellia, which is going to be anti inflammatory and for pain. And I'm also going to give her arnica. And I also have my Infla potion from Glacier Peak, a Peak Holistic, which is anti inflammatory and for pain. And then I also have their Herbaprin, which is also, again, Glacier Peak, anti inflammatory and for pain. So she's going to have multiple pain medications on board, and we're going to take what I would call an integrative approach to health for an emergency situation. And that's okay with me. I think that we need to be all right with letting our animals sometimes get an actual pharmaceutical when an emergency happens or when a severe condition happens, or maybe you just need to have that this time. No shaming. We don't shame. We educate. And if you can get something more natural, great. And if you can get something that works well, amazing. But if you have to use the pharmaceutical, if you can at least take an integrative approach, I think that's great. So that's where I'm at with
Well, I
Piper.
think yeah, well, and I think, this is a conversation that I've been having a lot lately too, is that, there in any group, there are always extremists. And of course,
Kim
every
says
time I want to
Kim
talk,
says she doesn't like extremists because they're
we don't
rude.
like extremists. But I think, especially with one thing that happened this year that was kind of big in the healthy pet space. We you a group of people get labeled by the extremists in that group.
Yeah.
And so people like us are being labeled as like, "Oh, they would never give pharmaceuticals, and that can be detrimental," and blah, you know what I like,
Mhm.
isn't there ever a situation and there are people in our space who would absolutely say, "No, never." But just like you said, we have to really look at what the quality of life of our animal is
Mhm.
and make a decision that is going to be best for them in the moment, understanding what we're doing and what the risks are and what we can do to mitigate those risks.
Mhm. Yeah, I completely agree. It's part of the reason why I don't like to say always or never, because
Yeah.
there's almost no situation that can be an always or never. It's almost impossible. So I just think being open minded is important. And I think that almost all of the well known, bigger names in our community, these vets or these doctors or these pet professionals, whatever they are, whatever their background or degree, they take an integrative approach to health. Sometimes they take the pharmaceutical or they recommend it. And sometimes they use the herb or the homeopathy or the chiropractic, right? But most of the time it's whatever is going to be best for you and your animal. So, and nobody knows that except for you and the person that you work with. Piper's going to get an integrative approach with her anti-inflammatories, and I'm going to feel good about it because I've had dental pain when I had my root canal with a retained tooth fragment, and I wanted to die. Oh, and that was not a fractured tooth with an exposed nerve. So I can't even imagine. So please give my dog the anti-inflammatories, and then I'm going to dump a bottle of ease down her throat as well. So and also, I got ozonated glycerin orally for
Oh,
her. So that's going
oh,
to arrive on
awesome.
Saturday. So I'm going to use that along with my colloidal silver spray in terms of like keeping the area clean. And I'm not going to accept, I know that they're going to try and get me to take oral antibiotics postoperatively. So I'm going to
Yeah.
come prepared with my things that I'm going to use holistically. So yeah.
It was funny, the last time I had Machida in for a dental, I had the same thing with the fluoride,
Yeah.
but when I picked him up, they gave me a bag of the, like, dental prescription kibble, and I literally pulled it out of the bag and put it on the counter, and I was like, "I'm not taking this."
Yeah. When Goose had his dental years ago, my cat, he had 3 teeth extracted routinely. They were not infected, and they
Yeah,
pressured me so much that I finally said, "Okay," and took them, and then I threw them away outside because I just didn't wanna argue anymore. I was like, "Yeah, I'll pay the
yeah.
$50. I'll just give them to me." Like,
Oh my
I know,
gosh.
and then I was
Yeah.
in a position to pay $50 for antibiotics, now I'm not. So,
Yeah.
yeah,
Well, and, to that same vein, this has been a number of years ago now when
yeah.
Romeo, one of my cats who has since passed away, he had, absorptive like,
Mhm.
resorptive disease,
Yeah,
and I took him in for a dental, I don't even like, literally, he had been in the year before, and they were like, "He's good, he doesn't need anything,"
yeah.
and then the following year, they were like, "We need to get him under anesthesia." He had 17 teeth
Oh,
pulled
buddy.
because of
Yeah,
the resorptive disease, and, they gave me this, like, I don't even know, I don't remember what it was, but I think it was Royal Canin, and it was
ugh,
junk,
yeah,
like, literal junk, but it was like, I took a can home, like, fine, whatever, and he would not eat. Like, I had so
yeah,
much on board, like, I was giving him the CBD, I was giving
yeah,
him all the things. I didn't have the extra THC at the time.
yeah, yeah.
It was not something I could access where I was living, but he was, I guess, just in so much pain that he was getting the anti-inflammatories, and I was doing all of that because I'm, like, 17 frickin' teeth pulled,
Yeah.
right? Like,
Right?
that's
Holy
crazy.
cow.
So I finally broke down and gave him that, and it was literally, I can't tell you how many foods I tried to feed him. Like,
Mhm.
I probably spent $100 in just, like, 1 can here or 1 pouch there, like, just
Yep.
anything to try it, to see if he would eat it, nothing. And he did eat it, something crazy with from Royal Canin, and I wound up having to buy a whole daggone case of it, and it was, like, $120 for a case of it.
That's
But it was, like,
unfortunate.
the only thing he would
Yeah.
eat, and I'm like, especially with a cat. Like, I
Yes.
can't
Yep.
just let you starve. I had to do it. I felt like I had to do it,
Yeah.
and I hated it, but I had to.
But you know what? It was he told you that this is what I need right now. This is what I need.
Yeah,
Please give it to me. And like, fine. If you're gonna eat, if it's that or starve, I guess it's gonna be that today.
yeah,
Fine.
right. Yeah,
It's and cats are
yeah,
tough. Cats are tough. And then I would assume once he was healed up a little bit, you probably got him back onto his more species appropriate
oh,
food.
yeah, yeah,
There you go.
absolutely.
Right? So sometimes
As
you
quickly
just
as I could.
as quickly as you could. Exactly. Exactly. So that was emergency number 1. Well, technically
Uh-huh,
emergency number 2 because it happened yesterday. Emergency number
yeah.
1 was last Thursday, um, when Bear all of a sudden couldn't walk.
Oh my goodness.
Yeah, so, and I'll have this up on my Instagram soon because I made, like, a chronicle so that you could see. But Bear's my golden retriever. He's 65 pounds of complete chaos all of the time. And never stops moving, never stops wagging his tail, never stops carrying something in his mouth, never stops headbutting and asking for pets, never stops panting in your face. Golden
Mhm,
retriever energy.
mhm.
Well, my husband came home from work with this inflatable beach ball that they gave him, and we were tossing around this beach ball in the air, and Bear was like jumping up and pawing it, jumping up and booping it. I joked that he was going to be the next Airbud because they're doing auditions for Airbud right now. So
Oh, really?
yeah, they really are. They're actually legitimately rebooting Airbud. I was like, what? So yeah. So, if anybody likes John Oliver, please go watch the 35-minute John Oliver skit about the new Airbud. You will die laughing. So we're joking that he's going to be the next Airbud. We're throwing around this, I don't know, 5 minutes maybe, max, 5 minutes max. That was the only new or unusual activity for the day. Otherwise, we had a lot of errands to run, went grocery shopping. We didn't go to the park. We didn't go for a walk. He went potty outside a few times, came back inside. That is it. That evening, after we're done watching TV and we decide to get up to go to bed, we all stand up. Bear does not get up. That has never happened before. This dog, as soon as I
Mhm.
twitch my calf muscle, he's on top of me and he knows I'm getting ready to move. So I'm like, come on, bud, let's go potty. And he went to stand and he just whined. And I was like, oh my God. So, me being who I am, of course, my mind actually went to the most dangerous potential thing first, which is could he have had like a ruptured hemangiosarcoma? I don't know why I went there. I really don't. But that's where I went. So I turn on all the lights and I like lay him on his side and I'm like tunneling my hand under his ribs and like touching his belly and making sure it doesn't feel hard. And I'm like looking at his gums and at his eyes. I'm poking his gums to check his capillary refill. I'm like pressing on his tummy. I'm eliciting no discomfort whatsoever. He's just laying there and letting me do it. His coloring was fine. His gums looked fine. His belly was soft. So then I'm like, all right, I don't think he's bleeding to death. And he definitely doesn't have bloat. What
Thank
else could
goodness.
it be? So then I'm thinking, like, all right, well, he's a golden retriever. They're at risk for like hip dysplasias and joint ruptures. So then I'm like taking his arms and I'm ranging his wrist and his elbow and his shoulder and I'm moving him all around and I'm poking into his joint spaces. Nothing, nothing. So then I'm like, all right, is it your hips? So I'm like looking around with his hips and
Mhm.
I'm pressing down on his spine, his lumbar spine, his thoracic spine. I'm like trying to palpate to see if something's out of alignment. Nothing, no discomfort. So I'm like, what the hell? So I encourage him again and he finally stands up and he did the saddest, most pathetic shuffle to the front door I have ever seen. Went down the 7 stairs, peed, pooped, everything looked totally normal. And yes, I went out and I looked at that poop with my flashlight and then hobbled his way back up the stairs into the house, up the other full set of stairs into the bedroom and laid down. And he just looked miserable. I mean, his tail was tucked. He was not happy. So at this point, it was 10 p.m. and I gave in to good sense and I called poor Dr. Loudon. I love her so much. Oh my God. Dr. Loudon, if you're listening, I love you so much. So she answers the phone. She's like, is everything okay? 'Cause why else would I call at 10 p.m.? And I'm
Yeah.
like, no, I don't know what to do. I think Bear hurt himself. So I tell her, actually, I wasn't even thinking about the ball. And she's like, did you do anything
Oh,
different
yeah.
today? Anything unusual? Anything new? And I'm like, no, wait, we played with a beach ball. So I described how we played and she goes, It could be his neck. And I'm like, his neck?
Mm.
Why would jumping up in the air hurt his neck? Wouldn't that hurt his back? Wouldn't that put his hips at risk? And I had sent her a video of him trying to walk, and she was like, "No, looks like neck. Try this maneuver." And so I took his head in my hands and I tried to tilt him to the side, and he immediately pulled away and started whining. And I was like, oh my God, thank God for Dr. Loudon. So, I mean, he couldn't stand up. He was hunched. He was clearly in pain. And to just put it in perspective for you, one time he had a tick embedded in him that I could not get out. And I literally took a scalpel and just gave him a little. That might sound crazy to people. Just so you know, I'm a nurse practitioner. I literally suture people for a living. I know how to use a scalpel. I didn't just slash my dog, but I took just a little bit, just to get the head out because I couldn't, and it was all stuck. And I got it out very easily, but I did make a little teeny little shallow slice. This dog, all I did was pick up his head and look at me like, are you doing something down there? Nothing.
Right?
I mean, he has a high pain tolerance. He one time almost completely tore off his dew claw and it was like dangling. And I never knew that he hurt himself, except that I looked down and saw blood all over the place and I had to figure out who it belonged to. Not a whine,
Yeah.
not a limp, not a nothing. He was outside playing on his dangly dew claw. Like this dog does not show pain. So he was clearly in a lot of pain. And I said, I mean, I have a lot of stuff on board. I can give him some ease. I have Herbaprin, I have Inflapotion, I have Arnica. And she said, do you want to consider a short burst of steroids? I don't think you should monkey around with the neck. And from the way he's walking and standing, he probably pinched a nerve. And I said,
Mm.
yep. So in addition to all of the natural anti-inflammatories, I got 3 doses of prednisone. And guess what? He is acting like nothing ever happened. Within a day and a half, he was back to being a psycho, which then I had to give him all kinds of calming drugs. Like
Mhm.
I gave him calming CBD and some of this glacier piece because I was like, you need to relax. Like, but I
Right?
mean, it turned him around like this. And again, this is another example where I hate steroids. I think they're one of the
Yeah.
most overprescribed, overused, and abused drugs on the market. We put animals and people on steroids constantly, and we never take them off, or we give it to them repeatedly and we don't think about the consequences. But when you have an
Mhm.
acute situation like this, either an acute nerve injury or an acute respiratory issue like COPD or asthma flare, steroids save lives. And
Mhm.
so a short burst of steroids to get that inflammation down in order to control pain and not risk nerve damage, of course I will give that. And now he's great. And I didn't even give him the full 5 days. I gave him 3. And I do not feel bad. Just putting it out there again, guys. I don't feel bad. We took an integrative approach and my dog is no longer crying out in pain. I mean, I was bawling on the bed, like with my head shoved into his fur, just shaking, crying because I was like, you're in pain. I don't know what to do for you. And me freaking out is not making you feel better, but I can't control myself. Like, it was
Oh my
crazy.
goodness.
This has not been my week, girl. This has not been
Ugh.
my week.
Yeah. I don't know what it's like to have a dog that has such a high pain tolerance because Kim,
Yeah.
nope. I don't have a pain tolerance. She has less than me.
Yeah.
It has happened twice. I've been changing her diet lately, not like drastically and
Yeah.
nothing that I wouldn't recommend to anybody else, but I'm creating a lot more diversity because I'm working on her gut health.
Yeah.
And it has created some like she's having some loose stool every once in a while.
Yeah.
Not every day, it's not consistent, um but she I th- literally twice in the past week I will sit down in the spot that I'm sitting right now
Yeah.
and she will have been totally fine and all of a sudden she gets up next to me and she starts shaking and she just looks at me and she's like, she's shaking. She's like, I don't know what's going on. I don't know what's going on. I'm like,
No.
and it's always around like she's having diarrhea.
Yeah.
And I'm like, I think her stomach is bothering her. I think
Yeah.
she's having some stomach pains. And she's like, I don't know what this pain is. Fix it.
Yeah. Yeah.
Which I don't have any GI Joe on hand, which is what I would normally use, which is another Animalio
Yeah.
blend, essential oil blend. I have no idea where my GI Joe went. I might have like lent it to somebody.
Uh,
and not gotten it back. But that's why I have my chamomile out because
yeah,
I'm like, even though I can't give her the GI Joe to settle her stomach, the chamomile, I just literally put a couple drops on my hand and I rub it either on her back or on her stomach and just give it a few minutes and I just cuddle and snuggle with her and she like calms down
feels
and
better.
lays down and we're
Good.
all good and everything goes back to normal. But she has no
Yeah.
pain tolerance whatsoever.
That's so funny. Yeah, I mean, my other dog is like that, Copper. Like, if I even look at him with the nail clippers in my hand, he's and I'm like, "Oh god, you're such a baby." Like, I don't know. If I can't like, if I wanna look in his ears, he's like pulling away from me. He's such a wimp. But Bear, no, I could, like, shove my finger in one ear and have it come out the next, partly because he's brainless, but partly because he wouldn't even feel it. Like, so the fact that he was clearly in so much pain, I was like, "Man,
Yeah.
this is really rough." But now he's much better, and after tomorrow, Piper's gonna be minus a couple of teeth, but she's still gonna have a pretty smile. So,
Yeah. Yeah. Um, I think but I mean, that's a good lesson, and
yeah.
especially coming from us
Yeah.
because we talk so much about the more holistic modalities that we
Mhm.
use to kind of put things in perspective for people that, like,
Yeah.
this is approachable. What we are doing with our pets is actually approachable. We're not sitting here, neither one of us sitting here saying, like, it's this way or the highway. It's what I do or it's nothing. It's
Yeah.
like we can make incremental improvements and still utilize what our veterinarians are good for when
Yeah.
we need it,
Yeah, for sure.
especially in emergency medicine.
Especially in emergencies, and, I mean, I've worked almost my whole career in emergency medicine as a people provider, and, like, you don't always have you don't always get to choose if you're gonna have an emergency, right? Well, you never get to choose if it's an emergency
Well,
because it's
no.
an emergency, but what I mean is, like, you can't choose the modality if you're having an
Mhm.
emergency, right? Like, something that is life, limb threatening, you have to do what you have to do, and the same applies to our animals. Now, do I think that a lot of things maybe are overdone? Or do I think that people sometimes take their pets to an emergency clinic when it's not a true emergency and that does lead to inappropriate or unnecessary treatments? Yes. Yes, I do. But for a true actual emergency or actual severe pain or, something like I said, life or limb threatening, please use the emergency room. That's what it's there for. We want to save your life
Mm,
and your limbs if we can. And at the end of the day, I'm going to do what's right for my pets. And in this case, it was an integrative approach. And tomorrow, after her procedure, it's going to be a holistic approach because I'm not going to take antibiotics. She doesn't have an infection. We're going to use natural things. I'm going to support her body naturally. I have a sitter that's going to come and sit with her now while I'm at work until we move. Because once we move, like I said, we don't need the crate. And then we're going to continue working though on making sure she is feeling calm and safe while we're at work. Just not having the crate doesn't all of a sudden mean her anxiety is gone. We got the crate because she's
right.
anxious. So that is still going to require investigation and work. But I'm going to do what I need to do to make sure that she's safe and she's not harming herself. And I hope that that doesn't mean a pharmaceutical, but I also will not let my dog hurt herself. And I have
Mhm.
to go to work. So we'll see what we can do. And I will use a 20 layered approach of holistic modalities if that's what I need to do. But at the end of the day, her safety is the most important thing. And I will take an integrative approach if I have to, because she's my baby,
Yeah.
my 9-year-old
Of course.
grumpy, crotchety, curmudgeony baby. And I love her.
Crotchety.
She
Crotchety.
is. She's crabby
Yeah.
in her old age
Aw.
in a good way.
Aw. Well, and I will say, and probably similarly to what you experienced, I have had to take him to the emergency vet one time. It was
Yeah.
many years ago. And it was before I realized how low her pain tolerance was. And
Yeah.
she literally, like, she was kind of like what Bear was doing, like, where
Yeah.
she was acting like it was painful to walk. But, like, I couldn't figure it out. Did exactly what you did,
Yeah.
and I'm doing everything, and I'm moving her head, and I'm, like, going through all of her like, I'm doing everything and seeing, like, where she's having a pain response, not finding a pain response, but she's literally acting like she can't walk, and I think she jumped off the bed, like a high bed, and
Yeah.
it just was,
Sprain
like,
something.
that was yeah, they didn't ask for anything. It was literally just a form I filled out, and I just checked the box that she was up to date on rabies, and nobody asked me for anything or
Yeah.
proof. And I'm like, I know I shouldn't do this,
Yeah.
but also I'm not willing to if I need to have that conversation
Yeah.
later, if they ask for proof and I can't provide, that's another story. But I'm like, I know that she's protect. I know I have this piece of paper that tells me that she has an immune response. Like, I
Yeah.
don't feel like I'm putting anybody in danger. I don't know. Anyway,
No,
just
I know. I agree. I totally agree. And you're right. Emergency clinics, they don't ask for that kind of proof when you're there because it's an emergency. For me, it's because she's going to have a surgery. So,
yeah.
but we'll see what happens. Yeah. It's been a stressful week and I'm excited for the full moon to pass and move on to the next month.
Yeah. Right? Well, 2025 has been
Yeah,
an
I'm kind of done with
absolutely
that
insane it for everybody
for
in our
everybody.
friend group, I
Yeah.
think.
Yeah. It's like, have you read the Hunger Games series?
I haven't read them, no,
It's,
I've only seen the movies.
it's, It's like a dystopian, well, okay,
Yeah.
you watched the movies, you said, okay. So,
Yeah.
you know
Yeah.
how in the second book or the second movie, they have the quarter quell? It's 25-year anniversary of the Hunger Games,
Oh,
and so it's an
okay.
extra bad, like, themed arena, like, they made it extra bad for people that year. I feel like
Uh-huh.
2025 is like the quarter quell. I don't know what's going on, but it's just extra bad this year. Like, it's just
Well,
not
it is
great.
going back to all the spiritual woo-woo stuff, it
Yeah,
is a 9-year, and in a 9-year, anything that isn't meant to go with you into your
yeah.
next chapter ends. Like, the 9 years, like, "We're done. This is it. It's over. You're not taking this with you. You're moving forward," and I feel
Okay.
like we are all feeling that so hard.
I hope this means that I'm not taking any animal injuries with me into the new year. That's what I'm hoping my
Right?
9 year is saying.
Right? So,
Gosh.
sometimes I do it's not always a physical thing. I think sometimes it's just a mindset shift or, like, whatever you're
Yeah.
learning
Yeah.
from your pets right now is what you're taking into the new year. I don't know, but it has been crazy for all of us.
Yeah.
I'm done with it too.
I know.
Believe me, I'm done with it.
I know. So it's all right. We're embodying our transformation. We're going to come into the next year like a
Yeah.
beautiful butterfly.
I know, I think I posted online a couple of weeks ago, I was like, "This has been so hard, but maybe it's everything I needed," right?
Yeah.
Like, you just don't know.
Yeah.
It's hindsight until you get anyway, I thank you so much for jumping on last minute.
Thank
That
you
was,
so
like, the
much for
craziest thing.
asking me to.
I was like, "Man, I feel like I'm all set up. I feel like I should record. I don't
Yeah.
know. What am I gonna record?" But I literally just recorded a solo episode yesterday, and I'm like, "I can't do another solo
Yeah.
episode."
Well, my brain is all yours anytime.
Thank you so much. I appreciate you, and guys, check out is everything updated now to Raw Remedies
It is,
Health?
yeah, rawremedieshealth.com, and then my Facebook, my Instagram, my TikTok is all Raw Remedies Health, and then my YouTube is Raw Remedies Podcast. So it is Raw Remedies
Okay.
everywhere. And I even managed to get my Google reviews to move over from Raw Pod Ventures. I thought I was going to lose them all, but I did not.
Yeah.
So that's very exciting.
Oh my gosh, that's
Yeah.
amazing. That's really, really cool, actually. Very happy for you for
Yeah.
that. Thanks, Kara, for being here, and I just hope you guys take away from this that it really is whatever is gonna be in the best interest of our animals at the time, and even in an emergency situation, it is okay to step back for a moment and catch your breath and not just let everything going on around you to kinda dictate what needs to be done, because even in an emergency situation, you have a moment to breathe and just say, "This is," like, listen to your gut, listen to your intuition. How does it feel? What is gonna be best for your individual pet at that time? Thank you so much. And guys, I will talk to you next week. Please give your pets some extra love from me and Kara this week.
Thanks,
Bye,
everybody.
guys.
Bye, Jess.